Hernias come in a variety of locations in the body. The most common are abdominal wall hernias that we see. They can happen more naturally through normal weak spots in the abdominal wall, such as the inguinal regions or the groins. They can happen around the belly button, another natural weak spot. Commonly they happen after someone has had open surgery. They've been repaired at the muscular level, but that repair has come apart over the years. The net effect of all of those situations is you have a hole in the abdominal wall. It's actually the fascia. Often we refer to it as the muscle of the abdominal wall having a defect. What happens is it's all about pressure. So when people cough or strain at the stool or sneeze or twist or lift, we call that valsalva. Whenever someone increases that pressure, things tend to want to pop through those defects. Many times they pop in and out and it aggravates them, but it's an ongoing problem that's self-limited and they never really seek medical attention for it, but it can get stuck. So if the intestine or the omental fat, which is a fatty apron in the abdomen, pokes through that hole and isn't relieved back through, you can have ongoing symptoms and it becomes quite painful and a surgical emergency if that happens.
The approach to repairing these, I think it depends on the patient. Depends on the type of hernia, how big it is, where it's located, what previous surgeries they've had. You know, we may offer them an open repair where we go from the outside in, or a minimally invasive repair, whether it's laparoscopic or robotic assisted. Those are a couple approaches that we'll use, but really I kind of tailor it to the patient as far as what's going to be best for them. Probably majority of the time we are using a piece of mesh, usually, so the mesh is basically a foreign body and it goes in there and we use that to reinforce the repair, and the body will form scar tissue around that to help heal that up and decrease the chance that hernia could come back in the future.